So it's 5 o'clock and we'll get started. We wanted to thank you for joining us for our first ever segment of Dr. Swathi's Corner. And we're really excited. This is going to be an ongoing series that we're going to be doing and really sharing information about CBD and health and wellness and lots of really great information. So we're really excited for you to be joining us. I'm Davina Kaonohi, the CEO and co-founder of Element Apothec. And Element Apothec is a new disruptive body care and wellness brand. We're launching in the phytocannabinoid space and really coming out with really clean, safe, and innovative products. We'll be starting our pre-sale soon. We're actually just launched our equity crowdfunding campaign on WeFunder. We'll share more information on our Instagram about that. But most excited is that we have Dr. Swathi. She's our Chief Science Officer, and she's joining us, like I said, for our first segment of Dr. Swathi's Corner. We're also going to be sharing information on our Instagram as well, and Dr. Swathi will be giving great information to help you understand the whole world of CBD and health and wellness. So Dr. Swathi, I'd love for you to share a little bit about who you are and your role with Element Apothec.
Yeah, definitely. So I'm Dr. Swathi, as Davina mentioned. I'm based in LA now, but I've lived all over the country practicing pharmacy. And so over the past year, I've really had the opportunity to delve into integrative health and medical cannabis. And through that, I've had the chance to work with patients in the clinic setting. I had a chance to work with patients in the pharmacy setting. So really quite a variety of patients, different areas of LA. But then apart from that, I've spent a lot of my time consulting. And so through the consulting, it's been a lot of different educational ventures, whether that was, working with a brand to create content, speaking of which I have a new article coming out for Element Apothec tomorrow. But that's very exciting. I was just finishing it. So a lot of education, a lot of creating medically driven content, a lot of evidence-based content. But apart from that as well, also teaching at various colleges of pharmacy and colleges of traditional Chinese medicine. I have a few adjunct faculty positions, and I got to teach 2 full courses this past semester at a college in Santa Monica. So I really enjoyed that. And we're prepping for the next semester. So yeah, what I really am passionate about is being able to share information about the endocannabinoid system, about how food can really be medicine, and just overall looking at health in a holistic viewpoint and how we can target so many different modalities to try to help patients in the best way possible, because probably more than one modality is best for each patient.
Right, and how do you see your role at Element Apothec? How are you going to be involved with the company?
Yeah, so I'm Chief Scientific Officer, and so I really just want to be there for the team if the team has any questions regarding formulations, and also be there for the patients. So if you guys have any questions, I'm more than excited to answer them. My email is linked on some of the articles, and it'll be linked elsewhere too. So just feel free to send me an email, and we can continue the conversation about anything in the integrative wellness space.
Yeah, we'll be adding onto our website, which is exciting, an area for Dr. Swathi as well, where you'll be able to ask questions and contact her. And we're really excited because it's so confusing. I think oftentimes people don't even know what CBD is or how do they incorporate it into their life, and there's so much misinformation. So we're really excited to have you as part of the team and really provide that information to our customers and to anybody out there really to really understand what that is. So tell me a little bit about your background in CBD and cannabis. You shared a lot about schools you've been to and your involvement, but if you could dive a little bit deeper specifically into that.
Yeah, definitely. So this past year, as I said, I've really had the opportunity to hone in on the integrative health skills and that skill set. And so through that, working at the pharmacy out here in LA, I've had the chance to interact with patients and really do a comprehensive medication therapy management appointment where I can go through all of their medications and field any of the questions that they have. And a lot of questions are CBD based or cannabis based. So I'm really able to delve in and talk to them about really anything that they're interested in and use that as an opportunity for education. So I've had a chance to do that at the pharmacy, and then also at the clinic. I worked in an HIV clinic. I hope I can go back after all the COVID and everything and continue to go there. But I really enjoyed seeing patients there and kind of doing the same thing and being there to be a part of the team. So to field questions from the other practitioners. There's a lot of other integrative practitioners that work there, but then I could also see patients one-on-one. So really being able to chat about CBD and cannabis as much as possible and really see a lot of patients benefit from it.
Right. Yeah, there's so many amazing benefits that are still even yet to be discovered as well. And so if you could tell us, what exactly is CBD?
Yeah, definitely. So CBD is one of the constituents or one of the compounds that is derived from the cannabis plant, or hemp plant. And so I think we'll delve in a little bit later about like CBD versus THC. But I think the most important thing to know is that CBD has been researched and studied for so many years. And a lot of the products out there, you'll see say CBD on them. There might be other things in them too. So just knowing that CBD is something that has been looked into extensively, and there's so much great ongoing research too. And I think a lot of it has come down to like anxiety, especially in the times now. I've been getting a lot of questions about CBD for anxiety, for immune health as well, for immune function. And then also for epilepsy, like the FDA approved medication is the cannabidiol product. So,
right. Yeah. And so you talked about the endocannabinoid system.
Yeah.
What is that if somebody hasn't heard about that before?
Definitely. So the endocannabinoid system is so complex, and it's something that current practitioners are learning about as well as consumers kind of at the same time, just because it's not a part of the medical curriculum yet. So it's not something I learned in school, which is kind of incredible if you thought it, just because the more you learn about the endocannabinoid system, it's unbelievable that it's not something that we would learn in school. It's known to be linked to a lot of other organ systems in the body. And so it can really help regulate and maintain homeostasis in the body. So homeostasis meaning balance. And so balance is just so important when we're looking at different organs and how they function. And also like mood and like that type of balance too is really important. So the endocannabinoid system, there are two main receptors. There's CB1, so cannabinoid type receptor 1, and then CB2 is the other one. And those are dispersed all throughout your body. There's a very dense concentration of CB1 that's in your central nervous system. And then in terms of CB2, it's a bit more densely populated when it comes to immune function. So that's kind of the distinction, but really there are cannabinoid receptors in so many parts of your body, which goes to show that cannabis can really impact so many parts of your body and so many organ systems, which is really incredible. Yeah, so those are the two receptors. And then also to talk about CBD and THC being phytocannabinoids. So phyto meaning from the plant, so cannabinoids that are from the plant. But that also we have endocannabinoids. So endocannabinoids are the cannabinoids that we manufacture ourselves. They're processed and produced in the body. And those two are anandamide and 2-AG. It's a very, very long name, but everyone just calls it 2-AG. So those are the two. And when they've been looked at to try to understand, at least from like the top standpoint, anandamide binds to CB1, just as THC binds to CB1. So I think that's a really good parallel when you're trying to think of, okay, there are these 4 new terms that I don't know, at least like those two we can kind of put in a similar category. And then CBD and 2-AG we can also kind of put in a similar category like that to start thinking about how they work and what they could be used for. The other thing I wanted to mention too, oh yeah, go ahead.
Right, it's just so much, valuable information for people to
it's
really
so much.
Yeah, it's great.
Yeah, the other thing I wanted to say too is that endocannabinoids are very different from other like neurotransmitters in your body. So neurotransmitters being like serotonin or dopamine, because those your body is constantly producing for whatever which reason. But the endocannabinoids are actually made on demand. So that's also quite a different distinction between endocannabinoids and other neurotransmitters as well as other things in the body. Yes, I just wanted to add that.
Yeah,
I just think that's
yeah,
so fascinating that they're created on demand.
Yeah, and we'll continue as Dr. Swathi said. We're going to continue doing more segments as well, and really diving deep into really helping people understand how CBD can really help with your endocannabinoid system, and it's really quite incredible as there's more research that comes out about that.
Yes.
So you mentioned CBD and THC. What's really the difference? Because I think there's a lot of confusion out there, and people really trying to understand what that difference actually is.
Yeah, definitely. So I think when it comes to CBD and THC, a lot of people are wondering, can they both get me high? Can only one of them get me high? Can I have those like euphoric effects? So the terminology that we've been starting to use is that they both are psychoactive, but that THC has the intoxicating or euphoric effects. So psychoactive really meaning that it's active in the mind or in the body, really. And so they're both in that way, if we're thinking about it, they are psychoactive. But they bind to different receptors. And so because they have different binding sites and different binding preferences, they function different in the body for different things. So THC has been known to be very strong with its binding to CB1. It also has some interaction with CB2. And then CBD is this mystical cannabinoid that we don't know exactly where it actually binds in the endocannabinoid system. We just know that it regulates it and it helps really just have that like sense of homeostasis. It's really incredible for that. But we actually don't know where it binds. So I think a lot of ongoing research right now is really trying to delve into that, because I think coming from the Western trained perspective when trying to explain it to other practitioners, I think that's one thing where they're like, oh, so you don't know where it binds, but you know it works, kind of a thing.
Right.
So I think that once that's elucidated, I think that will be very helpful for trying to like really start and continue that explanation with practitioners. Yeah, so CBD, THC, both from the plant rather than the endocannabinoid. So it's something that they have in similarity as well.
Mm-hmm. And then within CBD and THC, I mean,
okay, now we got it.
There's so many other minor cannabinoids and terpenes that are involved with the plant as well.
So many, yes.
That people are really, learning about and really trying to understand. It's one of the unique things about some of our products as well, is that we are combining some of the other phytocannabinoids in the plant, from the plant, that have been exposed, such as CBG and CBN, and we'll go in future sessions and talk more about
definitely.
That. Mm-hmm. Yeah. So does Element Apothec's products contain THC? I know that, is something people have asked before.
Mm-hmm. So I think a lot of people ask that because of the urine drug screens, because they're worried if there is that bit of THC in the product that it could potentially come up positive. And so I think it's really important to make that distinction that when we're talking about like isolate versus broad spectrum versus full spectrum, that they are really quite different in terms of what is in that product. So an isolate is only CBD. Everything else has been stripped away and it is only CBD isolate. When we're talking about broad spectrum, that's CBD plus a lot of the other minor cannabinoids, a lot of the terpenes, but what has really been removed is the THC content. So what that means is that there should not be any THC, if very, very little, but in general, there shouldn't be any THC in the broad spectrum products. And then the one that does have THC is the full spectrum. And so that means it has the CBD, has some minor cannabinoids at low percentages likely, as well as terpenes. But that's the one that can have THC in it. When I say can have THC, as per the Farm Bill in 2018, there can only be less than 0.3% of THC of the entire product. So yes, it might be there, and there's a lot of conversation about the ensemble effect or entourage effect that I'd love to chat more about. And there are practitioners that are on one side of the bandwagon and on the other side of the bandwagon of how they feel about both, and the research is super conflicting. So more to be seen with that. But I think that really is the distinction, that full spectrum has THC in it, and then the other two do not have any.
And then, I mean, one of the things I think that people often are aware is, like, can we even buy CBD products? And you highlighted the Farm Bill, and the Farm Bill did make it legal for companies to sell even the full spectrum products as well. And so, as you mentioned, Element Apothec's products are broad spectrum, and in time we'll look at some other options as well. And
I think broad spectrum is really great too for people who are introducing themselves to cannabis or CBD products for the first time, because I think people get a little scared of THC. So I think that looking at a broad spectrum is such a great place to start for a patient who's a little weary of, like, starting off with like a brand new product that they haven't tried before.
Right. Yeah, definitely. And how much CBD should patients start with if they're just starting and trying to figure out, because our products, we sell both the body care products as well as tinctures, and so if somebody's looking at it, what is a daily dose that would be recommended for somebody?
Definitely. We always say start low and go slow, particularly if you're not interacting with a practitioner on like a weekly basis. And when it comes to CBD, it really, well, cannabis in general, it really depends if the patient is cannabinoid naive or not. If the patient is cannabinoid naive, as in they've never tried any sort of cannabis products, whether that's medically, recreationally, throughout their entire life, then you're probably going to start a bit lower. But then if they're not cannabinoid naive, that means that they at least have some sort of idea what cannabis does to them, or maybe they've tried a CBD product and they have some sort of idea about how that's going to impact them. So then you can, depending on how it impacted them before, you can go from there and decide. Generally a daily dose, I think that's great, is like 10 milligrams to start, 10 to 20. Some people I've heard as well really like starting with the 20, or they do one day of the 10, they're like, oh, this is not, and then they want to do 20. But I would say it's really a range, 10 to 20. And I mean, then that brings up the entire discussion about like if there are drug interactions or any potential, depending on what the patient is on, which is a whole nother discussion. But
Right.
yeah, I would say overall like 10 to 20 is a great range for most patients.
Yeah, and as we mentioned earlier on our website, there will be the ability to ask Dr. Swathi questions. So obviously this is a lot of information to take in. And so you can always reach us through Instagram, you can reach us through our Facebook page or on our website and ask, especially if you are concerned about other medications that you might be taking and what that interaction is. We really want to be there for you and be able to guide you through this process, because CBD really does have so many incredible benefits that really help you. So yeah, we are really excited that you joined us for our first segment. And as I said, you can get more information on our webpage or on Instagram. But if you have any questions now, definitely post them on here. We can answer those questions for you. We're also, anybody that gives us feedback, we're going to have a drawing for a special gift for a $10 Amazon card. Soon we'll be sending out our future gifts will be our actual products, which will be really exciting. But we really do appreciate you taking some time on your Thursday to join us. We'll also put this on our Instagram, IGTV, so you can see this at any point as well.
And please let us know if there's something, like some topic you're really interested in, so we can focus on that. And we want to do these as frequent as possible, hopefully weekly, depending on how everything is going. So we really will be able to get to your topic if you send it to us. So just let us know. Yeah,
definitely, for sure. And as I said, this was our first segment of Dr. Swathi's Corner. We're really excited that you joined us, and we will be doing these frequently. And again, as Dr. Swathi said, if there is any information that you want to know or questions or you want us to cover in future segments, then please let us know. Let's see, it looks like I have a question.
Oh,
Oh, someone
great.
wants to know if we can give our webpage. Well, that's easy. So,
Oh, yes.
it's elementapothec.com. And again, if you're here on the Instagram page, there's a link in the bio to be able to connect to that. So any other questions that anybody has at this point? I guess we answered all the questions that they had. So that's great. Well, thank you, Dr. Swathi, for joining us today.
Thank you for having me. I love doing things like this. So I cannot wait to do more and talk about all the other incredible benefits that CBD and cannabis can have, as well as other, dietary phytochemicals that are present in your products. So much to discuss.
Yes, definitely. Everybody have a great night. Thank you so much.
Bye-bye.